Family Health, and I'm currently the acting deputy director as well. The Center for Family Health at the Department of Public Health oversees the genetic disease screening program, as well as the WIC and the maternal, child, and adolescent health programs. I'm going to kick us off today and start our fall California Prenatal Screening Program Town Hall. And so let's get started. Cameron, can you advance this one slide? So today we're going to review our program successes and challenges since we made the very big program transition last fall to splitting the test apart into cfDNA screening for chromosome aneuploidies and screening for neural tube defects separately. We're going to discuss the feedback that you've already provided to us about how we can improve our program. We'll discuss our plan to add sex chromosome aneuploidies to the panel. We have some questions that have already been submitted to us in advance, so we'll be answering those questions as well as taking questions from you live during this webinar. And then we'll be discussing steps on how to stay in touch with our program and understand what's happening. Next slide, please. So just a few logistics. This is a Zoom webinar. You attendees out there in the field don't have your video or your microphones enabled. However, you can communicate with us in two ways. At the bottom of your screen, if you move your cursor down to the very bottom, you will see two places you can communicate with us. One is the question and answer box. So if you click on that and ask a question, we will do our very best to answer that question during this webinar. There is another box for chat, and that will allow you to provide us comments, but not necessarily something you want us to answer live. You might just want to give us some feedback and tell us about how things are going for you, or you might be interacting with your other webinar attendees. So feel free to add things into the chat box if they're just comments, but if you want a question answered, please use the Q&A box. Next slide, please. So the first thing we wanted to talk to you about was the fact that last fall, about a year ago, a little bit more than a year ago, we made a very big transition and we changed from our biochemical method for testing for chromosome trisomies and moved to cfDNA. In that time, we have tested a little bit under 250,000 pregnancies, a little bit over 230,000 pregnancies have been screened with cfDNA technology. And of those, a little bit more than 1,500 were found to be positive. Our median specimen processing time for those is 8 days. In addition, a little bit more than that, a little bit more than 232,000 pregnancies have been screened for neural tube defects. And just a bit over 2,000 of those specimens were determined to be positive. And the median processing time for those is 5 days. And then at the same time that we transitioned to changing the method we're using for finding chromosome aneuploidies, we also launched our CalGenetic portal to allow you to submit requisitions electronically and get results back electronically. And we've had approximately 12,000 providers use that portal in the past year. Next slide, please. So while we've had this successful program up and running, there have been some challenges and growing pains in the beginning, especially, which made us pivot immediately and make some improvements. Some of the challenges we faced had to do with ordering through the portal. We have made some changes based on your feedback. We continue to make changes to make that portal better. A paperless result feature is coming next month, which will be the first time we've gone paperless in the 35 years of our program. The other thing we had at the very beginning was delayed result reporting at the beginning of the program launch, which was obviously a very important problem that we needed to fix. We have anticipated those kind of issues as we transition to add sex chromosome aneuploidies in the spring. And so we think that we've learned from our mistakes and we're able to anticipate those changes and make sure that doesn't happen again. In the short term, we had set up a call center to assist in responding to all the inquiries that we got from providers. A year later, the volume of calls that call center is getting has dropped so low that we've decommissioned the call center. However, we are increasing the staffing at our local follow-up centers so that we are prepared anytime in the future for upticks in requests or contact from our providers. Next slide, please. We appreciate you all as an engaged and committed community of providers. Like you, we recognize that 2022 did not roll out as smoothly as we wanted to, or as we all hoped it would. But we learned that the strength of our shared engagement and commitment is leading to improvement. We want to thank the countless providers who really stayed engaged through all of our challenges. And gave us invaluable feedback so that we can do better and meet the needs of both our providers and their patients. Next slide, please. When we sent out the invitation to this webinar, we also sent a survey, and we had more than 80 responses to that survey. We wanted to share that with you in advance and let you know that at the end of this webinar, we're going to give those of you who didn't have a chance to respond to the survey a chance to give us some feedback, because we are using that to drive the changes that we're making to our program. These are the top things that we heard back on. We're going to go through each of the top 6 just to provide you a little bit more detail about what we heard. Next slide, please. So the top thing we've heard from everybody is you need to integrate with our EMR system. And we realize that, yes, we do. We are working now to do that. It's a very big lift because not only does it require us to make changes on our end, but it requires your EMR systems, your IT people and your EMR systems to make changes on their end. So and of course we have to do these one by one. So we are signing people up now for that. We currently have 2 EMR systems signed up to work on that first. We're hoping that we have 6 to 8 people in our first cohort. And if you are interested in having your EMR system be in that first group of 6 to 8, we'd love for you to drop us an email so we can reach out and see if we can connect with the right people at your site. On the screen right now is the email that you should be emailing to, and it's pretty simple, pns@cdph.ca.gov. We will, of course, be providing you this slide deck after the meeting closes so that you will have all this information in your hands. Next slide, please. And we wanted to give you the details of what we heard on the first 2 themes that we heard you had problems with, which were the EMR system in our portal. So the things that were the highest on your list of needs was for us to fix the compatibility with your EMR system and to deal with the fact that our portal is time consuming. It takes you and your staff a lot of time to get the information in. And then there are problems with registering, renewing, and deleting your delegates, and we need to address those. So we have heard you. Next slide, please. With regard to the portal, you've heard a little bit about our EMR integration, which would help you not have to use the portal as much. We are also making some enhancements to the portal in spring of 2024. That would be adding a delegate manager role and allowing you to do bulk uploads of your delegates. And we're exploring new delegate requirements with our department's IT staff. As you can imagine, because this is access to patient medical records, and because these actually happen to be medical records of a genetic nature, which in California adds a whole nother level of protection to the medical record, that our department has some important rules that we're needing to follow to ensure security and privacy for those records. And so we're working with our IT department to find the best ways, not around them, but to find ways that we can make your experience better while still maintaining the security that we need to have for these records. In addition, we are making some changes to the screen to allow you access once you've submitted an order, like canceling already submitted orders or editing and updating orders that you've submitted. So we've heard you about that. I think that is all the last thing was that we will be adding patient name searches to the screen. We're working on how to do that with our IT department with regard to security and getting you the access you need when you don't have the form number, which has been a requirement all along. Next slide, please. So moving on, you had talked to us about you wanted us to add additional laboratories to do that screening. Currently, we are contracting with Natera, Quest Diagnostics, and Revity outside of the Kaiser system, of course. For now, we are focused on adding sex chromosome aneuploidy screening to our program. Once we get that live, then we will step back and evaluate about bringing other labs on, but before spring, we will not be doing that. We will just be working with the existing labs to bring sex chrome aneuploidies online. Next slide, please. All right. You asked about carrier screening, and we wanted to just make sure everybody knew that the focus of our prenatal screening program is to assess risk for the fetus. Furthermore, our screening is informed by professional organizations such as ACOG and ACMG and the guidance that they provide. And carrier screening of parents is not currently recommended at a population level. It's certainly something you can offer your patients individually, but not something that at this point in time we would be adding to our population level program. And that carrier screening, of course, can be done outside of our program with thorough genetic counseling attached to it. Next slide, please. We had some questions about ordering supplies. The ordering supplies issues are much more individual, and there isn't a broad single thing that we can address as a global level, but we always want to know about the problems you have ordering supplies, because those are usually things that we can fix on a one-off basis. There is a phone number on this slide, and again, you will be provided with this slide deck. That is a phone number that during business hours is always staffed by a live person that you can talk to about any issues you're having with supplies, and so that we can get you your supplies as quickly as possible and fix your problems. Next slide, please. And then we heard all about you want us to add sex chromosome aneuploidies to the screening panel. So it's a one-stop shop for you. Yes, in a couple of slides, we're going to go into the details about that, because that is one of our top priorities right now. More about that in a moment. Next slide, please. So I'm going to pause here for a minute. You've heard about what we've done to address some of the issues, or what we are doing to address some of the issues you've already reported to us and the problems we've seen ourselves. I just give you a moment to drop any questions you might have about what we're doing so far into the Q&A. Again, at the end of the session, we'll be doing Q&A. And of course, if you have any comments you want to make, you drop those in the chat. I'll just give a minute for you to do that. All right. I think we can move on to our next slide, Cameron. So we've come a very long way since program launch a year ago. We have started work on our next big initiative, which is adding sex chrome aneuploidies to the panel. We still have a lot of work to do. Along with your help, we really want to involve our community partners in this effort. So I'd like to introduce to you Robin Jimenez, the chief of the prenatal screening program, and Robin's going to walk you through what we're planning for with sex chrome aneuploidies.
Okay. All right. Thank you, Leslie. So as many of you already know, we've made the decision to add sex chromosome aneuploidies to the state cfDNA screening panel. We're going to walk you through how we came to this decision through our engagement, as well as feedback that we've received from community partners. Next slide. So we're going to be adding screening for the 4 better known sex chromosome aneuploidies, which are Turner syndrome, Klinefelter syndrome, XYY, and trisomy X. So like the current program is now, any participant that screens positive for any of these through our program will be authorized for covered follow-up services at our state authorized prenatal diagnosis centers, which you may know as our PDCs. We're also going to be covering participants that get inconclusive, otherwise known as no-call results for sex chromosome aneuploidies. So that's a big bonus. We're also going to be producing and printing, as well as putting online, patient and provider educational material about sex chromosome aneuploidies. And for providers, we'll also be including some literature about our new program. All right, next slide. So in order to update our program, we have to update the regulations regarding the prenatal screening program for the state. This will involve updating the panel to include SCAs, and we're scheduled to start the program in spring 2024. We will have a regulatory hearing in 2024 for comments on the updated regulations. The way that our program updates regulations is through an emergency process, which doesn't allow for public hearings prior to the enactment of the regulations. So if you have comments, please feel free to put them in the chat. If you have any questions, please put those in the Q&A, or you can always email our program at pns@cdph.ca.gov. And we'll also be communicating, about our program over the next 6 months or so, and we will let you know if there will be any proposed fee increases after the release of the governor's budget in January of 2024. All right, next slide, please. So we want to talk about how we came to decide what should be on the sex chromosome aneuploidy panel, and who we've talked to and who helped us define the scope of this phase of the program. So we've talked to a multitude of prenatal providers, including clinicians, prenatal screening experts, people with lived experiences, and members of professional and nonprofit organizations like ACOG and SMFM. We've also talked to other types of care providers on the ground, like our genetic counselors and our prenatal diagnostic center directors. So we started with a clinical work group earlier this summer, which helped us define the scope of the new program. In order to define our business rules for development, we had an implementation work group, which told us or instructed us on some best practices of how we should go about building and rolling out the cfDNA panel that includes sex chromosome aneuploidies. And those 2 work groups are pretty much completed. Our communications and education team at GDSP is still engaging with a health education review work group to preview and field test our patient and provider educational materials before they're finalized and released. Next slide. We've actually had some questions in the chat. So I think if you asked about the XY chromosome naming, this slide is for you. Our health education work group has told us about preferred terms to use in the field. Terms recommended to our program for sex chromosome aneuploidies were, an alternative was XY chromosome aneuploidies. For providers, we will use the terms sex chromosome aneuploidy and XY chromosome aneuploidy as an AKA. Mainly because we know that there are many providers in the field that only know them as sex chromosome aneuploidies, but the terminology is changing, and so we do want to be cognizant of that. For patients, in patient materials, we will provide the term X and or Y chromosome variations. We've had a lot of feedback from advocates and patients with lived experiences in the field, and we feel that this is the best term to use with patients. Terms that we're going to be using with everyone, patients and providers, will be the names of the 4 better known sex chromosome aneuploidies that we will be screening for. And each of these will be called out in the results mailer when you order them for your patients. Okay, next slide. So we have learned a lot and heard a lot from our different engagement discussions. One theme that we've heard and strongly appreciate is that the prenatal screening program is important to our participants, your patients, and our community wants us to succeed. So a couple of things we've heard are you want us to provide more communication and visibility about the benefits of our program. You want us to be transparent about what we as a program can't fix, what we can fix, and the timeline for fixes as we can provide them. And we've heard a lot that folks want the program to engage more closely with our interested parties and community partners. And our program staff have made diligent efforts throughout this year to achieve that. Also, some ways that folks have been helping us is that engagement partners can help us field test our new materials, like educational materials, and people with lived experiences and others have preferred terms to use, which we are going to incorporate in everything from education to website to printed materials. Okay, next slide. All right, so as a reminder, we just wanted to remind everyone of the current way to order sex chromosome aneuploidies, since our program is not going to offer them until spring of 2024. So the screening for sex chromosome aneuploidies is not covered by the current PNS program participation fee. Patients and clinicians may want to seek cfDNA screening outside of the state program, which may be covered by your patient's private insurance. We remind everyone to check with their patient's insurance company for individual coverage, and that if you do order this additional screening for your patient, it requires a separate test request process, separate from the state program. Some of our state contracted labs allow for the same blood sample to be used for both the state program and additional sex chromosome aneuploidy screening through their through their testing lab. But we just remind providers, if you're going to take advantage of this service, you do have to submit a separate test request form to the cfDNA laboratory that you're using. Okay, with that being said, we can go to the next slide. If you have any questions about our new offerings of SCA in spring 2024, hopefully we can answer some of them now. So go ahead and feel free to drop those in the chat.
Yeah, and Robin, we've gone through and answered some throughout the presentation. So I think the ones that aren't private, if we can read those questions and voice it out loud, it might be good for folks to hear.
So I have one for you, Robin. It's for inconclusive results. Would the lab reports from the prenatal screening program provide full details regarding any atypical findings that are noted, such as if the finding is suspected to be maternal in origin, or will the details be limited?
Right. So let me answer those for let me answer that question in two parts. So the first I'll talk about the 21 and 18 and 13 chromosomes, aneuploidies. So if there are any atypical findings, they are somewhat lab dependent. So at this time, even now, you can call Quest Diagnostics if you had your patients sent to them, and if you call them, we have our number. Sorry, we have their number on our website. I don't want to give it to you wrong here, but you can actually call them and speak with a genetic counselor for more details as to those atypical findings. Natera at this time, they are not releasing any additional details, and Revity Omics does not give a result of atypical findings. For sex chromosome aneuploidies, those may be denoted in the comments field in our results mailer. So we won't, if there is an atypical finding on a result versus an SCA atypical finding, that will be recognizable in the mailer, that those are different.
Okay, we have another question. Sorry, were you done, Robin?
Yeah, I'm done.
Okay. Can the provider ordering the test opt out of SCA screening when ordering cfDNA?
That's a great question. We went back and forth a lot of this on this a lot through the program definition of the scope of the screening, and with a lot of input from a lot of different community partners. We are going to have the entire panel screened for everyone. So at launch, providers will not be able to opt out of SCA screening when ordering cfDNA. That was also a strong recommendation by several professional societies to us.
Okay, so there was this question, I'm trying to piece it together because it's coming in parts. Can labs utilize the CalGenetics portal to submit PA requests? And then they clarified submitted by the lab, not the OBGYN, and then prior authorization for the cfDNA testing.
Oh, okay. So, okay, sorry, I thought PA was physician assistant. I was like, physician assistants can order through our portal. Okay, sorry, I misunderstood that. So there's no way where you can submit a prior authorization through our CalGenetic portal, but I think that's a really good suggestion, since we have a couple of really good suggestions about insurance and secondary insurance being available to, upload to our CalGenetic portal. We can't do that at this time, but that's definitely something we can look at doing. I mean, Emmy, did you want to say anything else about the pre-authorization?
Yeah, so for the prior authorization, in reality, our program doesn't require that, right? Because our program actually bill for participation fee, but we're trying to make trying to update, our regulation to be able to indicate that, to be more clear to our insurance provider. And the question about secondary insurance option. So you can actually provide us your secondary insurance information, not through the CalGenetic portal, but through our payment portal. So I provided a link. If you go to our PNS program, go to this section that says billing and payment. There's a section there where you can provide that information. Or we typically send an initial statement to the patient. For those ones that do not provide us their insurance, there would be an attached form where you can put that in and mail it out. And there would be an included envelope where you don't need to even pay for the stamp. So you can just send us that information.
So another question is somebody wanted more details on the professionals that were asking for SCA to be added to the screening panel. So I don't think it was just professionals, it was our entire, engagement group who included, parents and people with lived experience with X and Y variations and, others, but the professionals included, geneticists and all the folks who were on our original clinical issues work group.
Yes, and we also had some bioethicists as well to because we understand that this is, a bit more controversial and sensitive. So we did also engage those folks as well. I can take a couple of other questions, Faith. The question,
how about the one about for patients who don't want to know the sex?
Oh,
if
sure.
there are no SCAs present, will the sex result be blocked in some way so patient won't see result?
If the provider chooses that option, then yes. We can block the result if there are no SCAs present. If the provider says, no, my patient doesn't want to know the fetal sex, we will still report if there is an SCA. We do report in our, we are putting in our educational materials that if the patient wants to know from their provider what their SCA results are, they may find out the fetal sex of the baby, although again we caution our labs can confidently call fetal sex in most cases with an SCA, but there are chances of gonadal dysgenesis, so there's always that you might want to warn folks about.
Another one, Robin, is can you comment on the degree of confidence about how likely, adding SCAs to the screening panel will be implemented in the first half of 2024?
I am 100% confident. That is our day job. that is what we are doing. I know some folks have told us that it seems like 10 months is a little bit too long, but believe me, this is what we're doing all day, every day until we launch in spring.
There's another question that why aren't we just mirroring the panel offered by Natera through Panorama?
So our panel mirrors what's recommended for population screening by professional societies, which some of the bells and whistles of the private companies go beyond that. The way we are building our program is we can continue to enhance our screening panel as other recommendations for population screening are made by professional societies.
There's a question in the chat, Robin. I don't know if you can see it. It's about the limitations that providers and patients are experiencing with the current contracted labs within the state program. The examples are no information provided around findings and the challenge of no calls. The question is, can a more inclusive approach be taken in opening the program up for other labs to join that might benefit patient care and provider support specific to these areas. So the question is really, can we add more labs?
Yeah. So I'll mirror what Leslie said at the earlier part of the presentation, and that for this time until spring 2024, our main focus for improving the program is adding SCAs to our screening panel. After that, there's a possibility we will look into more labs, but we are not there at this time.
Okay, I want to ask Raphael Newport to repeat his question because it's not, I can't understand it. And then another question is, with the SCA launch in the spring, the results will not go directly to the patient at that time, correct?
That is correct. We no longer send any communications directly to patients from the prenatal screening program. That includes anything regarding MSAFP as well. Some of you who have been with us for a long time may remember that we did send basically like notifications to patients if their specimen was received and things like that. We no longer send any kind of outbound communications to any patients. We just send to providers. Your patients may they may get results directly from Quest or Natera through their proprietary commercial portals. GDSP does not control those communications.
There was a question around, you may have covered this, but will we continue to send MSAFP results? Wait, I lost the question. Through the mail, I guess? Sorry.
What's the question? What is it, Faith?
It was about sending are you going to continue to send email reminders for MSAFP?
So I think that was some we had some questions about email reminders for MSAFP, when those will start, can you opt out, can you opt in, that sort of thing. We again, some of you who have been through the program with us for a long time know that we used to send out a second trimester not received reminder mailer to the provider after 17 weeks of the second trimester specimen had not been received. So we no longer send out mailers like that if we get a cfDNA specimen and we don't have an MSAFP by 17 weeks. We are going to be rolling out a feature that we will send the provider and or their delegates, depending on who the provider wishes to get the email. We can send a reminder saying, hey, we don't have your MSAFP specimen received yet. You may want to go remind your patient. Those emails can be opted in, opted out. They won't be mandatory if you don't want them. The Raphael Newport Faith, I can mention that the SCA screening can have a discordant fetal sex report versus the phenotypic appreciation at birth due to gonadal dysgenesis. So sometimes, you'll have an XXY and at birth, the baby will appear female. And so that is just one thing you want to be cognizant of.
About, does the state currently have, I think, quality assurance for tracking incorrect sex prediction?
We will. We will. And why do I say that? So we have an entire unit that does surveys of all of our providers as to the outcome of pregnancy. So I'm sure some of the providers on this email remember completing those surveys for us. The survey period for the new program, which launched in September of 2022, has not begun yet. But I believe we may be making efforts to match to vital statistics. So that's kind of, a to be continued future research project.
Do you see the question by Lila Ree, Robin?
Yeah.
What about triploidy risk assessment? Will that be disclosed with results?
If like an odds ratio, an actual numeric value, a z-score will not be released with results or in lab comments as far as I know. It'll be more of a positive, negative, yes, no kind of answer. I'm not quite sure if that's what she was asking about. We have a couple of questions, Faith. I can just answer these. Will the program labs use all the same cutoffs for MSAFP? So the MSAFP is still run in-house by GDSP. And so even though we do have multiple contracting laboratory sites, they do all use the same cutoffs. So yes. So we can answer that question. Could the delegation access be extended to 12 months? We are trying. We are looking into that. California Department of Public Health is a bureaucracy, and we have to work through our channels. We are trying, but
that's one of those issues that we are working with IT and trying to extend, especially for delegates who are using the system every day. If you're always using it, is there any reason actually to require an extension at all? We're looking into that. So we hope to address that shortly.
Yeah. Okay.
So there was a question that I think you answered, Robin, about integration with EHR. That was just about the complexity at a place like Stanford. I don't know if you want to address that.
I could speak to that. Yeah. So ideally the goal would be to develop crosswalks with Epic, Cerner, a couple of the other big EMR companies. We are looking into that. Our consultants have some experience with just kind of the backbone of these EMRs. We are actually currently looking for at least an initial cohort of folks to move forward with EMR integration. So far, everyone who's been interested has been Epic. So we are definitely moving forward with configuring integration there. For your particular hospital system, like I think the question was Stanford, all we need to do is have a meeting with your technical team and our technical team to figure out what are the available resources and what's kind of the most streamlined path. And we are actively doing that now. So please contact us and we will get in touch with you, and not like, next year or anything, but like within, next week. So this is something we're actively doing.
This is a great question. Will midwives have the ability to add assigned delegates?
I don't believe they have that at this time. It has to do with the licensing differences between midwives versus medical doctors. If we can always talk with the midwives associations, to see if we can make a strong case to the medical board, but the the ability to have delegates is more determined by the license versus GDSP. So, but we can work with medical board on that if there's a case to be made. I'm not saying you guys don't need them. I'm just saying we have to be able to do it lawfully according to the license and the licensing board's needs.
So there's a question. There's a couple of people who want you to clarify on the triploidy comment. One was not all labs will find triploidy, but are you saying if they do suspect it, it will be in the lab comments, but official result could be screen negative or positive for something else? And then somebody else commented, will triploidy be included?
It will not be included as a official result. The labs control what their comments are. If the medical director of the lab thinks to put it in there, it can be put as a general comment, but otherwise, they would not be disclosing it as a result, as a direct result of our screening test.
Okay. There's a question. We have physicians and midwives in our office and all orders are placed under the physician. Patients at times are confused as to why.
I assume that's probably a delegate's, yeah, or the midwives have been placed as delegate. Yeah, it probably has to do with how they're delegated out. Since the provider can have delegates, but the midwives can't. So if it's a larger office, probably they want everyone to see everybody else's orders. And the easiest way to do that would be to make midwives delegates instead of having them order out on their own, I would think.
Some midwives can have delegates, can't they? But it's just about how it is set up in the portal, whether the physician has the midwife as a delegate or whether the midwife has also set up so that that person has delegates.
Yes, if you are a midwife and have questions about delegates, or if you are a midwife and delegate and have questions, you can contact my staff at our email and we can help sort things out for you. You know, we know that the portal is set up to be a self-service type of system, but if you do need help, we will try our best to help you.
Okay, quick side note. Can you just explain what delegates are? I guess not everyone on the call is familiar with that.
Delegates are staff or any other professional that a provider delegates to order prenatal screening tests on their behalf. So not all CalGenetic portal users are able to have delegates due to licensing restrictions. And again, those licensing restrictions are not controlled by GDSP, they're controlled by the different licensing boards.
So Robin, can I ask you to look at the questions that people sent in through our survey and just see if there's any that we haven't already covered? And then I would just recommend that participants on this town hall put in any last questions in the Q&A that you would like answered live. And we do have an exit poll, so hold on till the end, please.
Sure. So I'll go through these. If there are any other questions about these questions, just stop me because I'm going to be looking at my email here. So we had a question about reporting requirements for case management and who or how to contact for assistance, especially to train new staff. So on the CalGenetic portal in the Contact Us section, there will be a list of counties, and depending on your county, that now determines your regional case manager. If you are a Kaiser provider, you have the same case managers as the old program, either for Kaiser North or Kaiser South. So for non-Kaiser folks, your counties are listed on the CalGenetic portal, and you're either assigned to our coordinator center at Cedars-Sinai or at Valley Children's Hospital. It's not north to south as it used to be. It's basically if you're west side of California versus east side of California. Their contact information is there as of the 1st of this month. If you call them, you'll be routed directly to their center now. You will not be routed through a call center anymore. Some of the case managers, if you ask them, hey, if you call me, what are you going to need from me every time? They can review with you just the criteria that they'll ask you for each patient when confirming case pregnancy factors. And, you know, so your staff can prepare that and have a quick and efficient call about multiple patients at one time. So our case managers, also known as case coordinators, are very happy to work with you in terms of doing that. Okay, so we had another question about, are we considering fetal RH factor? Not at this time. One of the questions we got was some folks think that the testing is free through the prenatal screening program. So our testing unfortunately is not free. We are a fee for service program. The fee is for the patient to participate in our program. If they have a non-negative result that's not due to an inadequate specimen, then most likely they will be referred for follow-up services at our state authorized prenatal diagnosis centers free of charge. Maybe that's where the free confusion came in.
The free, Robin, might come from the fact that in California, that the statute for the program covers any insurance or managed care plan that's within California and overseen by the Department of Insurance or the Department of Managed Care is required to pay for the prenatal screening program in full with no co-pays or deductibles. So unfortunately, for any ERISA covered programs or out of state programs, patients may not be fully covered. But for those insurance plans, including Medi-Cal, that are in the state, it's fully covered because it's the prenatal screening program. And that would change for people who are currently getting CFDNA outside of the program. Once it becomes part of the program, at least in-state plans must cover it with no payment from the patient.
Yeah.
So SCAs will be covered by Medi-Cal along with everything else on the screening panel, because that has come up a few times.
Yes.
And there was another question, Robin. Sorry, did I cut you off?
No, I was just gonna say, so SCAs is when we go live next year, is not going to be like a separate charge to our screening program participation fee. It's only going to be one charge for the entire panel.
And for the question in, what about insurance companies that are self-funded like Google and Facebook? Would the patient have to pay a deductible? Unfortunately, possibly. We have no jurisdiction over self-funded programs. And so it is possible that that insurance company would require it, but we, you know, everybody's insurance coverage is different. Even people with the same plan have different levels of coverage. So we can't speak to that. Only the plans that are covered by the Department of Insurance and the Department of Managed Care would fall under that statute, which requires coverage.
So there was a question, Robin, about the time frame to be able to access genetic counseling through the prenatal diagnosis center with an abnormal result. And you did answer it in writing, but maybe you just want to share the answer. You said,
so the timing is a bit different if you're a Kaiser provider. Kaiser has its own scheduling ability for state authorized patients. For non-Kaiser patients, We expect our appointments to be made for our patients within 7 business days. Sometimes though, the prenatal diagnosis center may not reach out because, you know, things sometimes get lost. Our coordinators will do their best to follow up if an appointment has not been scheduled with the patient within 3 days. We can see that in our system, and we will follow up with the PDC and ask them if they've reached out to the patient. But the appointments are not scheduled through our coordinators. They are scheduled with the individual PDCs. And if you have trouble contacting your PDC, let us know. I have staff that's all they do all day. They talk to PDCs, so we can help with that.
Okay, there's 2 more questions. Do you see them, Robin?
Do I see? Okay, let me look.
The triploidy answer wasn't clear. Will triploidy be covered as part of SCA screening? That is what it sounded like Robin said. Did you say that, Robin?
No, we're not going to call that triploidy out. So like you won't ever get a test result that says that.
Okay,
Yeah.
that seems clear. And then do we cover the draw fee? Because the lab typically utilized by the questionnaire is starting to add on an additional draw fee.
Emmy, do you want to take that one? Is Emmy still here?
Yeah, no, I'm still here. Yes.
Okay.
So, when we go live with SCA, yes, testing lab should not bill you for the blood draw fee because from our contract, our screening is a bundled test, which include those. So the cost we will bill your insurance should include the blood draw.
Okay, so I'm gonna say that we're done with the questions because I went through the chat and the answered questions, and there's no more open questions. And you've gone through the questions that came in previously, Robin?
Yeah, there's actually one additional one I wanted to mention because I know we've seen this a couple of times. So providers have asked us if they can pre-fill out or pre-print the orders through our CalGenetic portal before the patient arrives. Yes, you can. At this time, once an order is submitted, it cannot be edited, but you can save that order in draft. And so once it is submitted, it can be pre-printed. At this time, if there's a huge error, you do have to create a new order. We're working on some additional features for our portal where you can delete orders that are not correct, or if the patient decides that they don't actually want to go in and draw that, get a draw. So we're working on enhancements to our portal, but it can be done ahead of time. Okay, I'm done, Faith. Yeah.
I think we're ready to go on to the next slide.
Oh, okay, sorry, this is my slide. Okay, so how to get updates from our prenatal screening program. We're going to continue with our engagement activities, such as through our health education review group. We have our newsletter that we try to get out every month. You can scan the QR code on your screen there. You can also visit our website to sign up for the newsletter and much more. Shameless plug here. And we will be holding a public regulatory hearing sometime in spring of 2024 regarding our update to regulations, including addition of sex chromosome aneuploidies screening and a potential fee increase. Okay, hopefully everyone's got a picture or screenshot of this QR code, but like I said, you can sign up on our website. So if you could go to the next slide. Okay, so if you want to contact us, I know we are at time. You can reach us at gdsp.communications@cdph.ca.gov. If you have any other questions about how to operate within the program or getting supplies, you can email us at the letters PNS@cdph.ca.gov, and my staff will help you. Next slide. All right, so we ask that before you leave, you take our one survey question. I believe there are 8 options. Of one of our folks on the Zoom is going to open up this poll. So changing a large program takes time. So please help us understand your priorities, and please identify the program improvement you most want the PNS program to prioritize. And if you could let us know your #1 priority, I see the poll has been launched. This will help steer us how we will use our time. I have 15 staff, and this is what we do all day. So, all right, I see some.
And just to remind people, you probably only see 6 on your screen, but if you scroll down with the little bar on the right, there's 2 more that are down below: communication with the program and ordering.
Okay, and we'll release the results of the this poll with our next newsletter, upcoming communications, and a transcript and a recording of this webinar will also be available. So otherwise, we can stay on for a few more minutes if you have any other questions. But thank you for attending our prenatal screening program town hall, and we look forward with communicating with you in the future. So T, Ellen Jasmer cannot find the survey. Does it pop up or?
Yeah,
Okay.
yeah, it should pop up on your screen.
Okay.
I don't know why it's not.
It
We're
might be
getting a lot of responses, so I see that a lot of folks have already seen it.
I think if your screen is minimized, if your Zoom screen is minimized, you have to click on the 3 little dots, and it'll show you like if there's a poll. Dr. Maureen Boshin has a question for you, Faith and Seti. I can't tell, so Maureen, we can get back to you with that.
I think we were up to about 240.
Okay.
And presumably, so we're going to post this on our website, and presumably more people will watch the recording. So we're keeping the poll open for a few more minutes.
Okay. Are there any other questions in the Q&A?
Who do I contact to have the draw fee issue resolved? And the answer is Emmy Lou, but we can have her contact you. We have your email address, Sophia.
Oh, sure, or okay.
Or you can address it now if you want to, Emmy Lou.
Yeah, so currently right now, draw fee, you have to contact your insurance company to ask if they cover that under your benefits. Because for our program, the draw fee will be included in our bundled services once we go live with SCA.
Okay, I think we're done.
I think, are we ready to close the poll?
Yep, everyone's participated.
Perfect.
Good night.
All right.
Thanks so much, everyone.
Okay, thank you.